Good afternoon, everyone. Andrew Prokop, Mayor, Town of Taber, back here again for our weekly COVID-19 update. For this week's update, we thought it was a good idea to change the format to some degree and send out requests on our Town of Taber Facebook page for our local residents and area residents to submit questions they have in relation to the COVID-19 situation. As a result of that inquiry, we did receive a number of questions from Taber or area residents. Question number one, does the Town of Taber plan on giving deferrals to homeowners for town utilities? Our council is currently looking at a number of options to assist both residents and businesses alike in our communities. Once these decisions are made, we will be letting the public know as a result and pass on that information accordingly. Number two, what is the status of Cornfest? The Chamber of Commerce actually organizes Cornfest, so the decision will be theirs and the status will come from them. At this time, we know the organizing committee will make the best decision for the health and safety of all residents and visitors. Next question, will the town be propping up lids of community garbage cans like the city of Lethbridge has done? Yes, in fact, our crews are installing that hardware as we speak. Next question, what steps are we taking as a jurisdiction to make sure that we will not have a food crisis, and what about farmers markets? The government of Alberta has deemed the food supply chain an essential service, and they are saying that our food supply remains strong. What our community can do to make sure that doesn't have an issue related to a food crisis is to not to stockpile, not hoard food, and only go grocery shopping once per week and buy only what you need. Since the beginning of this pandemic, our Town Emergency Operations Center staff have been liaising with our local food supply stores to check that they are receiving adequate stocks and to make sure that they are comfortable with the levels of goods they are receiving. At this time, there are no concerns that have been noted, but we will continue to monitor and work with those services as the situation carries on. Farmers markets have been deemed essential services as well, and as long as they are selling food only. Next question, will we come together safely, of course, and create some community greenhouses to supply our food banks? Many farms and businesses throughout the region support our local food banks with crops and funding. If you're interested in supporting the local food bank by growing a garden, we suggest contacting them directly to see what the current status is and how they can help, and you can support them. Next question, I see groups of kids playing in various areas. It seems like the parents aren't enforcing the rules for their children. Is there anyone I can call to report this? And what is being done to enforce the stay-at-home rules? To answer that question, if you see anyone that is not following the public health orders, please submit a complaint to Alberta Health Services. A link can be found on the Government of Alberta website, and I would like to remind all citizens that the law enforcement agencies have now the power to and authority to ticket and charge anyone found not complying with public health orders. Next question. I live in an apartment building where people are still having parties or inviting people over. Because we're in a shared space, it's actually hard to deal with. And what can we do? Answer to that question, if you're in a shared living facility or apartment building, please talk to your landlord so they can assist you in enforcing public health orders. If you know of anyone breaking public health orders, we ask you to submit a complaint to Alberta Health Services using their online form found on the Government of Alberta website. Our residents have asked a lot of questions about our hospital, public health orders, and why everyone has to follow the same rules. These questions actually belong in the jurisdiction of our medical professionals. So as a result, Dr. Hargrove, our local community medical director for Taber, has kindly provided the following answers to these next questions, and we thank her kindly for her assistance. All right, next question. What is the current plan in place for our hospital if an outbreak is to occur in town, and is it equipped to deal with an outbreak? Every hospital in Alberta has been given a role to play in the pandemic situations such as COVID-19. In Taber, we are all prepared and equipped to treat patients who present with COVID-19 or other respiratory conditions. Should a patient come to our hospital in severe respiratory distress, our role at the Taber Health Center is to stabilize our patients and transfer them to Lethbridge. Chinook Regional Hospital has cleared out entire units where COVID-19 patients would be treated most safely and they would have ready access to intensive care units and specialists if required. In the case of a larger outbreak in southern Alberta, Taber is part of a network of hospitals where we have plans to treat all patients requiring hospitalization for COVID-19, and also to care for other patients requiring hospitalization for all other reasons. It is likely our hospital would receive all non-COVID-19 patients and provide their care, while COVID-19 patient care will be centralized in Lethbridge and Medicine Hat. Dr. Hargrove would also like to point out that most people who do contact COVID-19 have mild symptoms. Many patients with COVID-19 are assessed and discharged home for ongoing self-isolation. In southern Alberta to date, there have been 36 cases and only one patient has required hospitalization. If you have symptoms of infection, the instructions continue to be, if your symptoms are mild, stay at home and self-isolate. Call 811 or fill in the AHS online assessment tool. Most Albertans who develop symptoms will now qualify to be tested for COVID-19, but this is arranged through the 811 number so as to keep infected patients out of the hospital and prevent further spread. Do not come to the hospital to be tested. Call 811. If you feel unable to manage your symptoms at home, call 811 for direction on how to proceed. You will also be given direction to call your family doctor's office for guidance. If you have an emergency, call 911 or go to the emergency department. For patients of the Taber Clinic, your healthcare teams are available to you as well. Please call for an appointment. All the doctors, nurses, and nurse practitioners are working hard to provide care through the pandemic in new ways as it evolves. We are offering as many visits as possible by phone or video to minimize the need for people to leave their homes. We will help you determine what kind of visit is appropriate for your concern. We are also advising people if the routine tests like blood work or follow-up treatments or x-rays can be safely deferred until the peak of the pandemic passes. Next medical question, do we have any COVID-19 cases in the town of Taber? Yes, we have had 3 confirmed cases in Taber area. These cases were all in returning travelers. None of these patients has required hospitalization and have been safely treating themselves in self-isolation with ongoing follow-up with the public health. Next questions. Why do we as a small community and not a large center like Calgary, Edmonton, Toronto, have to continue to follow the guidelines set forth by our government and not try to get our local people back to work? We have businesses that can function with one or more relations and fully set up procedures to continue safe practices. When will this step be brought forward to higher authorities? To answer that question, as a province, the measures put in place by our medical experts are only effective if the majority of Albertans are following them. For the benefit of the whole of our society, some of the tricky things involved with COVID-19 are that infected patients are contagious before showing symptoms, and many people who are infected may never have symptoms, but can inadvertently spread the virus to others, some who ultimately may become very ill and could die. It only takes one asymptomatic or pre-symptomatic patient to attend a store and interact with several people to infect even one other person, and it amplifies from there. We're very fortunate to live in a country where the government has implemented financial programs to help individuals and businesses through this difficult time in order to minimize the rapid spread of COVID-19, so that we can help those who do fall ill and not have a health care system that is overwhelmed, as we have seen in other countries such as Italy, cities such as New York, etc. Closer to home, I can tell you that High River has a rapid spread of COVID-19 and went from 18 cases this weekend to 164 as of yesterday. Brooks now has 13 confirmed cases and are bracing for more. We are not immune in Taber because we are a small community. I would encourage residents to tune into our provincial medical leader, Dr. Hinshaw's daily Alberta update as a source of truth in COVID-19 for Alberta. Physical distancing has been effective to flatten the curve or slow the spread in Alberta, but modeling shows that we can expect a higher rate of infections in the next couple of weeks. I hope that in the month of May, Dr. Hinshaw will be able to provide us some direction as to when the restrictions on gatherings, businesses, and schools can start to be lifted, but we must wait and follow the guidance of our trusted experts. Next medical question. When will we have antibody testing so that we can figure out whom is being exposed and whom have not been exposed so we can go back to work safely and confidently. To answer that question, scientists and doctors are hard at work all over the world to develop a vaccine. They're also looking at antibody testing, which might help us predict how and when social restrictions can be lifted. However, there is no validated test in Canada or vaccine at this time, and the best known effective way to minimize transmission of the virus and try to stop it from spreading is physical distancing and self-isolation. Next question, when will we have masks available? Masks are available for all healthcare workers in their place of work. Surgical masks and N95 masks are to be reserved for medical personnel. Residents going for necessary outings, groceries for example, are encouraged to maintain physical distancing recommendations, wash hands frequently, and avoid touching your face. Universal masking is also now encouraged. This means to wear a cloth mask or scarf bandana when out in public, as this will decrease each person's droplet spread. If everyone wore a mask in public, it could decrease transmission significantly. Countries such as Japan and Korea, where universal masking was implemented early, have done much better with reducing COVID-19 spread. Thank you all for submitting your questions. I hope our responses to these questions were helpful and you understand that it is involved as well as plans going forward. As your mayor and council, we understand the many concerns you have and the fact that these are difficult times. Once again, we shall get through this pandemic time. We will most certainly get through this together. Thanks again to all of you for your compliance, caring, perseverance, patience, and understanding. All of these Alberta Health Services and provincial government requirements are put in place for Alberta's safety and well-being. Be kind as always, look after yourself and others, stay safe, be well, and have a great weekend. Thank you.